Okay, guys, so while I get this pulled up, I am going to kind of introduce what's going to happen for these two lectures. I have to say to start, you may hear my dogs in the background. They follow me all over my house. So they are currently sitting on a bed behind me. So this is chapter 20. I'm going to leave this minimized as opposed to showing the animation or showing the presentation full screen so that I can take notes on the slides. And I will also take notes down here where it says click to add notes. Once I have completed this chapter, I'm going to save this chapter by itself, and then I will post this particular PowerPoint presentation so that you have any notes that I took on the slides or in the notes section here. So you will have access to anything that I do today. You don't have to worry about taking like screenshots or anything of what I'm doing here, or going back through the PowerPoint slides just to look for my notes. So you'll have the chapter slides as they are right now, and you'll have the slides as I edit them as I go. And then you will have access to a YouTube link that you're already currently aware of to go back and listen to this anytime you'd like. So here we go. This is chapter 20. It's not going to be too terribly long, just like chapter 9, but they kind of go together. So we are finishing chapter 10 right now in class talking about strength training. But this chapter and the next chapter just talk about general prescription for fitness and exercise. So this is not anything necessarily focused on cardiovascular exercise or strength training, but a combination of the two, or a combination based on what's best for your client or yourself. So we'll talk about exercise prescription first, and then monitoring exercise and how to monitor exercise intensity, because that's one of the most important things that you can do, and then how to develop a well-rounded exercise program. So to start, I have to say that exercise, as we know, is just not a priority in the United States. A lot of times there are excuses made for why exercise is not a priority. I don't have time. I don't know how. I don't have a gym membership. I don't want to. It's hard. There's lots of excuses why individuals choose not to exercise. Think about yourself. Do you exercise or do you not? If you do, when did you start? And why did you start? What was the decision to get you to start exercising? Was it something that your family's always done or not? Is it something that came from within you? And if you don't exercise, think about why. You've been in a class now for 2/3, if not 3/4 of a semester, where we talk about the benefits of exercise. So hopefully if you don't exercise or haven't before, you're thinking about starting because of all the good benefits that you can gain from an exercise program. But in the world of science, we know these things. We know that exercise is beneficial, both cardiovascular exercise and strength training, and a combination of the two is best for overall general health. But a lot of people don't understand that or even care to understand. So awareness of health benefits is not necessarily high. A lot of people know that exercise is good for you, but they don't know just how good it is. And a lot of individuals are scared to even get started because they don't know what they're supposed to do. Really, if you're telling somebody what you're supposed to do to get started exercising, just tell them to move more. Really, the most important thing you can do for yourself is just move more. Somebody doesn't need to know exactly what to do to be healthy or to do to exercise. Exercise can be a lot of different things to different people. It can be yoga, it can be walking. Even just 15 minutes of running a couple of days a week can be super beneficial to your cardiorespiratory systems. But it's better when you do it every day. So think about it. If you just need 15 minutes, a lot of times when I'm talking to clients, when I'm talking to people about starting exercise programs, I discuss with them, just do 5 minutes. If you can talk yourself into getting dressed, putting on your shoes, putting on your pants and your shirt that you're going to use to go exercise, putting a coat on now because it's cold outside, and just go do 5 minutes of something. If you talk yourself into just 5 minutes, then chances are you're going to be able to do at least 15 or 30 minutes. When you get started, that's the hardest part. So if you can convince yourself to do just 5 minutes, chances are that 5 minutes isn't going to feel worth it to you, so you're going to want to do more. Or you're going to start to feel good about that 5 minutes and say, you know what, I could do 10 minutes or I could do 15 minutes, but you got to start somewhere. So oftentimes I try to convince individuals that doing just 5 minutes is better than nothing. And if you really do start and you're in 5 minutes into the workout and you really just are miserable and you don't want to keep going, then you call it a day and at least you did something. Excuse me, guys, my nose is running. But again, the higher the intensity, the better the payout. So we'll talk about that here shortly. This is not going to move. There we go. Before you prescribe exercise to anyone, if you are unaware of their current overall health, one of the best things and one of the most recommended things that you can do is obtain or measure some physiological parameters to obtain medical clearance. So medical information can be provided by somebody, but the accuracy of that with regard to the individual's willingness to be truthful and their memory as to whether or not they are healthy or not can vary. So if you're able to measure things like blood pressure, percent body fat, blood lipid values, or obtain those values from like a physician, you can gain medical clearance. And that medical clearance is used to develop exercise prescription. So somebody who is less healthy, so someone who is maybe diseased, may have a completely different exercise prescription and be prescribed a completely different program than someone who is not diseased and is relatively healthy otherwise. So most importantly, medical clearance provides a baseline. So this baseline gives us information about the overall health of the individual. And it also gives us information about how risky it is for this person to perform exercise. So think about it. If somebody has heart disease, it can be detrimental to them to perform higher intensity exercise, but it may be really good for them to perform low intensity exercise because that can then lead to anatomic adaptations and physiological adaptations that we talked about back in chapter 11. Chapter 21. It was chapter 21 when we talked about coronary artery disease and heart disease in general. So think back to all those beneficial effects of cardiovascular exercise. In an individual with heart disease, we won't prescribe strength training. That's too high, too intense, and that can cause complications. That can actually cause someone to have a heart attack as opposed to prevent them from having one. So we will never, in someone who is an at-risk individual, particularly with regard to cardiovascular disease, prescribe strength training. But we will start them with a cardiovascular training program. So we'll start them with like walking or a light jog, depending on their current status. But we need to know their current status, so medical clearance provides us that. We can determine whether or not an individual is at high risk and whether or not they need supervision. I had a client once upon a time who had heart disease, and he was placed on a beta blocker, and the beta blocker prevents heart rate from increasing above a certain value, above a certain beats per minute. So that individual was only allowed to do a certain amount of work. Remember, as work increases, as workload increases, heart rate increases, and it's a relatively linear relationship. So we were only allowed to, as exercise physiologists, recommended by his physician, we were only allowed to increase his heart rate to 100 beats per minute. And that was as far as we could go. So we kept a heart rate monitor on this individual to make sure that his heart rate didn't go above that, and we were keeping him safe. Really, all he could do was walk on a treadmill, but it was enough because he was in such bad shape to begin with that it was helping him and helping his cardiovascular system adapt and become healthier. So over time, he could lessen the dosage of the beta blocker and increase his heart even more without risk of complication. So medical supervision can be a necessity for some individuals, but medical clearance provides us with information as to whether or not that's needed. the evaluation, so a medical evaluation, again, also provides motivation. If you test somebody's blood, if you measure someone's blood pressure and they don't realize they have high blood pressure, it can be a kind of a kick to them to say, you know what, you really need to get this under control. Especially with regard to like things like percent body fat. You may measure someone's percent body fat and it may be much higher than they expected, and it can kind of just be this wake up call to say, you know what, you're unhealthy and you need to take the steps to become healthy. And remember, blood lipid values, remember LDL cholesterol above, again, fasting above 100 is considered a risk factor, and HDL below that, below 50, is considered a risk factor for heart disease. So blood lipid values are a good indication of risk for heart disease. And telling someone that, saying you have LDL cholesterol that's higher than 100 and HDL that's lower than 50 puts you at risk for a heart attack and for heart disease. That can be a wake-up call for someone to say, wow, I really need to change. But without that, they may have never known that or even thought that was a problem. So we get medical clearance to make sure that an individual is healthy enough to exercise. But it also tells us how much and what mode of exercise to use. So it ensures proper exercise prescription to make sure that we keep somebody safe. And that can then be monitored over time to make sure that gains are happening and to also identify possible dangerous conditions sooner rather than later. So if we do medical clearance, we can say, hey, your blood pressure is really, really high. And this is such a high number that you're at risk for, A, B, and C complications. You may not be someone with extremely high blood pressure, just like someone with heart disease. We will never prescribe strength training. The intensity of muscle contraction is far too high, and it puts those individuals at risk for coronary or for heart complications. High blood pressure, remember, it won't kill you itself, but it does put extra stress on the heart. So high blood pressure alone makes the heart work harder to push against that high blood pressure. Well, in strength training, blood pressure increases pretty dramatically because think about it, the muscle is contracting really intensely, and the blood vessels that are making their way through that muscle are getting occluded as the muscle contracts, which increases blood pressure periodically. Well, if blood pressure is already high and then an intense muscle contraction increases it even further, that can then cause someone to actually end up having a heart attack. The mechanism by which that happens is much more complicated, but we're going to leave it at that for right now. So medical clearance allows us to assess risk. And if an individual is low risk or considered healthy, then continued medical evaluation is not required. Even if we're sure that someone's healthy, it's still okay to do medical clearance testing, because we can measure their blood pressure, we can measure their body fat, we can measure their blood lipid values, we measure a resting and exercising EKG tracing. There may be something there that we wouldn't have seen, because someone can look overall healthy from the outside, but there may be something going on internally. So even if you're not concerned about an individual and you consider them healthy, it's still okay to do an assessment and end up saying, yes, you're low risk and yes, you're healthy. So you don't need to be evaluated and you don't need to be monitored from this point forward. Moderate risk individuals have at least 2 risk factors for cardiovascular, pulmonary or metabolic disease, but not necessarily have signs or symptoms. So in this instance, if we know someone has a risk factor for cardiovascular disease, remember back in chapter 21, we talked about risk factors, both controllable and uncontrollable risk factors for cardiovascular disease. So think about those, go back and take a look at those from chapter 21 and think about having 2 risk factors or more. And it could be age, it could be smoking, it could be familial history, it could be blood lipid profiles, it could be a diabetic individual. There can be any combination of at least 2 risk factors, but not necessarily outward signs or symptoms of those. That's where medical evaluation is recommended. After the medical clearance assessment has been done, and typically those individuals will be monitored over time, but not closely. You get monitored closely once you're a high-risk individual, which is 1 or more signs or symptoms of disease. That's when a medical evaluation, I wouldn't say is recommended, but is actually required. So I'm going to go just like this. If you are sure someone has coronary artery disease, or you are sure someone has diabetes, they have to see their doctor before they initiate an exercise program, because those diseases complicate the response in your body to exercise. Exercise for those individuals can be good, but it has to be done right. So assessing risk by performing medical clearance testing is one of the most important things that we can do for our clients, for ourselves, before we even get started. Those risks that I was talking about are listed here. They're in the red box. So women above the age of 55, I said age, family history, cigarette smoking, the lipid profile, diabetes, obesity. Down here is sedentary lifestyle. We're going to finish by talking about this. That's one of the worst things that you can do for yourself. And that's actually a risk factor for coronary artery disease. So those 2, if you have 2 risk factors, say you are above the age of 55 and a woman, and you have a family history, you may not have disease, but you may have risk factors for developing that disease, which is what number 2 on the previous slide up here was getting at. These are all risk factors for disease, but if you actually have signs and symptoms of the disease, that's different. So if you know you have diabetes and you have, or you know that you have high blood pressure, and depending on how high that blood pressure is, you may have cardiovascular complications, you may have renal complications. So depending on the severity of the disease, we will very drastically change exercise prescription. And by doing that, by assessing medical clearance and your risk, that risk stratification, saying you're low risk, medium risk, moderate risk, or high risk, we can actually help identify several things. So by testing someone for medical clearance prior to initiating an exercise program, yes, it does help us develop an exercise prescription, but it also can tell us a lot. Like, do you have medical contraindications? Are you at risk for coronary artery disease? Are you at risk for diabetes? Or do you have it currently, you just didn't know it? You'd be very surprised at how many times someone has pre-diabetes, so think insulin insensitivity, and has no idea that they have it. And they are at risk for developing diabetes and don't know. Exercise can help prevent that. We're going to talk about that in the last week of class, how diabetes can help how exercise can help modulate the diabetic condition. But some individuals may not know that they have a heart condition, or they may not know that they have an arrhythmia. This risk stratification and the medical assessment tests can help us identify those. Again, clinical conditions that need medical supervision, think heart disease, very, very high blood pressure, diabetes. These individuals are at risk for cardiac events during exercise. And typically, if an individual has heart disease, they are more at risk while they're exercising to have an event. So someone who has, say, heart disease, when they're resting, typically won't have complications. But when they start exercising, that's when we typically see complications typically manifest. So if someone is at risk for for a heart attack because they have heart disease. Usually when they're resting, it's a very mild state. It's a low intensity, so there's not really much concern for heart attack, even though someone has heart disease, which puts them at a higher risk of heart attack. Until you start to increase the intensity of exercise, say think like 60 to 70 or 85% of VO2 max. So you're getting up there with regard to cardiovascular intensity. That's when we'll start to see complications. And if a heart attack is going to occur, we usually see it at the higher intensities. But this risk stratification can tell us whether or not there is a risk for disease, or any medical evaluation needs to occur, or any exercise testing prior to exercise. So we can test blood samples for blood lipid profiles. We can test blood pressure pretty easily. We can test a whole bunch of things to see if there's any risks that our client has or our patient has that would maybe ask us to do a little bit more testing to make sure that they're still safe and healthy during an exercise program. So that testing is by way of graded exercise testing. So before an exercise program begins, one of the best things that you can do in terms of obtaining medical clearance is have someone undergo a graded exercise test. So I already have a couple of notes here. TM is treadmill. Treadmill testing is the most common because it tends to be walking or running is easy for individuals. Everybody can walk and everybody can run. So treadmill testing, because it's walking and running, is just an easy way to test someone because it tends to be comfortable. But it completely depends on the athlete, the comfort of the individual. For example, have they ever been on a treadmill before? If not, I had a client at a wellness center several years ago who got on a treadmill, then stepped back off, came over to me and said, I don't know how to turn it on. I went with her, showed her all the buttons and whistles and all the things that happen on the treadmill, and got her started at this. And she was comfortable from that point forward, but I worked with her a couple of times. There was also another lady who was afraid to ask for help, got on a treadmill and fell off the treadmill because she accidentally pushed a button that placed her into one of the treadmill programs, and it started to increase the incline in speed without her knowing it. And before she knew it, she flew off the back of the treadmill. She ended up being okay, but that can be really detrimental. That could actually end up in a broken bone or even worse. For someone who's uncomfortable with a treadmill. So if they've never been on a treadmill before, maybe a bike would be more comfortable. Are they familiar with a bike? If they're not familiar with a bike, then we probably will ask them to try to get more comfortable with a treadmill. Maybe we'll have them walk on it a couple times just to get used to it. Because if you see from this picture here, this person has a 12 lead EKG, there's a blood pressure cuff on. If we're testing an athlete for like VO2 max, they would even have a face mask on. So there's a lot of discomfort that comes along with graded exercise testing. We want our patients to be as comfortable as possible. And it depends on, again, if we're testing an athlete and they're a cyclist, we're not going to put a cyclist on a treadmill. We're going to put them on a bike, but we're going to put a runner on a treadmill. So comfort and familiarity is huge when it comes to graded exercise testing. If someone's more comfortable on a bike, then we'll test them on a bike. If they're more comfortable on a treadmill, then we'll test them on a treadmill. With regard to graded exercise testing, there are stages. So we typically start on a treadmill and have someone start by just walking. And they start walking on a flat treadmill with no incline, extremely slow. In a healthy individual, the speed at which you're walking in the first exercise stage is almost so slow that it's difficult to maintain a normal gait. So it's extremely slow, like 1.5 to 2 miles per hour. It's very, very slow walk. And every stage of the graded exercise test runs for 2 to 3 minutes. Now remember, where have we heard 2 to 3 minutes before? How long does it take to reach steady state? Remember, as you transition from rest to exercise, I usually use a 10-minute mile or a 9-minute mile pace. When you go from walking to running, and then you stay at one pace, heart rate increases, stroke volume increases, cardiac output increases, blood pressure increases, ventilation increases. All of those increases occur, but take time to reach steady state. That time is 2 to 3 minutes. So at about the 1.5 to 2 minute mark, you're reaching steady state. So we take measurements between 2 to 3 minutes to obtain steady state values. Because we know at about 1.5 to 2 minutes, you're reaching steady state. So blood pressure, EKG measurements, meaning heart rate, or just reviewing the waves and complexes on the EKG tracing, all occur between 2 to 3 minutes during each exercise stage. And remember, when you increase in intensity, so if you go from rest to walking, it takes about 2 to 3 minutes to reach steady state. Steady state heart rate, cardiac output, stroke volume, blood pressure, ventilation, all of those parameters will increase to match the oxygen need of the muscle, right? Because a given amount of work requires a given amount of oxygen, which requires a given amount of cardiac output. That will probably not be the last time I say that. So, but I've said it before and I'll say it again. So those 2 to 3 minute stages just takes time to get to steady state. Once we reach a steady state value, we can take a measurement because we know that measurement, the steady state measurement, is an accurate measurement for a given intensity. Meaning that heart rate is increased until it needs to. Blood pressure is increased until it needs to. No more, no less. Your body only works as hard as it has to. So that accurate measurement is steady state. That value gives us an accurate measurement or a representative value. How about representative? A representative measurement for a given exercise intensity. So, and we can take measurements at each stage of the exercise test, from a very easy stage to a harder and harder and harder and harder intensity, so that we can track changes in physiological parameters like your EKG tracing, like blood pressure, like oxygen consumption over time. So you start on a flat, no incline treadmill, and you walk slow for 2 to 3 minutes. Then each stage after that 2 to 3 minutes increases in incline and speed. So not only are you walking or running or your pace is faster, but you also increase incline. So you start walking up a hill. At the end of each stage, between 2 to 3 minutes, we measure and ask the subject how they feel. Your most important piece of this entire graded exercise test is your subject. If the subject feels good to go on to the next stage, meaning you're about to increase the incline and increase the speed of the treadmill, then you go. If your subject says, no, I don't feel comfortable, then you stop, period. At no point do you ever increase the incline and speed and move on to the next stage if the subject says they're done. No ifs, ands, or buts about it. So those measurements are to each stage is 2 to 3 minutes. Every initial stage starts on a flat with no incline treadmill and walking slow. And then every stage beyond that increases both speed and incline. Most graded exercise tests, GXTs, should only last about 10 to 12 minutes until an individual reaches max. Now, there are different types of graded exercise tests. You can do a submaximal graded exercise test, where if you're concerned about cardiovascular complications or if you know someone has a disease, it's not safe to perform a graded exercise test in certain populations. So in those populations, we will never, ever, ever perform a maximal graded exercise test. Let me make that note. So we are able to use submaximal graded exercise tests and track things like heart rate and blood pressure over time, because we know heart rate increases linearly with an increase in intensity. So we will ramp up between stages, both incline and speed, purposely. Increasing speed will allow you to increase intensity, but increasing incline as well just kind of exponentially increases intensity, and it causes a person to work harder faster. So the 10 to 12 minutes until a person, if you're doing a maximal graded exercise test, it shouldn't last longer than about 10 to 12 minutes, maybe 15 at the most. Longer than 15 minutes can induce fatigue, and you'll end up not being able to evaluate a true maximal effort. So if it goes too long, you can end up just causing fatigue in the individual, and you're not actually getting a true maximal effort because the individual is just tired. So a true maximal graded exercise test should only last about 10, 12 minutes. Submaximal graded exercise tests maybe last a little bit less, a little bit shorter than that, but it depends on the test. You can do, there's one test that's submaximal where you can do 2 3-minute stages with a rest stage in between. So graded exercise testing can vary. There's a submaximal test where there's a rest stage, 2 to 3 minutes, light exercise stage, again, 2 to 3 minutes, recovery, 2 to 3 minutes. We're going to call it moderate exercise, so a greater intensity, but not maximal, for 2 to 3 minutes, and then a recovery stage for 2 to 3 minutes. That's a really easy, simple graded exercise test that can be performed with just a bike or a treadmill and an EKG monitor and a blood pressure cuff. So that can be a really easy test. But this test can really tell us how your body responds to exercise. So before you start an exercise program, we can evaluate how you respond to exercise itself. Do you respond well? Does your heart rate increase when we expect it to? Does blood pressure go up and down when we expect it to, or not? And if it doesn't, then we need to go to our doctor and figure out why. So we can assess risk really easily and really well, really accurately, by performing graded exercise testing. That's one of the most important tests that you can do. And monitoring and exercising EKG is incredibly important. Because we can basically, in a resting EKG, more often than not always, resting EKGs do not show or manifest abnormalities. I know it says that there, but I want to reiterate that because that's important. Abnormalities are typically observed at higher intensities. Think about it. Someone who is at risk for heart disease or is at risk for a heart attack, when they're sitting on the couch watching television, the risk is relatively low. They're not putting forth much, if any, effort at all. But they go outside and shovel snow, or they go outside and play basketball for the first time in 20 or 30 years, whatever it might be. When they start to do that and their body hasn't done that in a long time, when there's some blockage in the coronary vessels, they may cause a heart attack and drop on the court, or when they're shoveling snow. So, and that's when an underlying disease will manifest itself. So we can do graded exercise testing, usually submaximal if we're concerned in any way, can allow us to observe abnormalities that we may not see at rest. You guys are getting my typing skills today. An exercising EKG usually can unmask some indication of coronary artery disease, or it can detect arrhythmias. So you may have a slight arrhythmia that doesn't cause any problem while you're resting, but may be a big problem when you're exercising. So there is a syndrome in kids called long QT syndrome. So remember, Q is here, right? So that's the beginning of ventricular depolarization. And then the ventricles complete depolarization through the S, but they actually complete contraction all the way into the T wave. As these are close to the T wave, as the ventricles start to repolarize in the T wave, then they will relax. So during contraction, the ventricles are pumping blood out, and then during relaxation, they're able to fill. Well, long QT syndrome extends this interval here, and that interval prevents the cells from repolarizing properly. And if they're not repolarizing properly, then the heart can't fill with blood properly. Remember, during repolarization, the cells are relaxing, and as the cells relax, they begin to drop pressure in the ventricle, and then the ventricles begin to fill. And if the ventricles don't have the adequate time to fill, then they won't have enough blood to pump out the next cycle. So long QT syndrome extends the QT interval between the Q wave, or the Q of the QRS complex, and the beginning of the T. So the ventricles end up contracting a little bit too long, and aren't able to begin repolarization and consequently relaxation in an efficient manner. So that I actually worked at the Children's Hospital of Philadelphia for a 3-month clinical internship during my master's degree, and I assessed long QT syndrome in individuals, in young individuals, anywhere from like 8, 9, 10 years old all the way up to 18, 19, 20. And those individuals are not allowed to play sports. They are at such a high risk of a cardiac event, and it could be cardiac failure, that they are not allowed to engage in any sports. If they exercise, they are either monitored or only allowed to do a certain amount. And that depends on how severe the disease is. So detecting arrhythmias can be a huge deal when it comes to prescribing safe exercise for that particular individual. And as well, right here, there's an ST segment depression. You may also see an ST segment elevation. Those are both the depression is an indication of myocardial ischemia, which is lack of blood flow, or an ST segment elevation, maybe an indication that someone's having or has recently had a heart attack. So those abnormal EKG tracings can be observed during exercise, where you may not see them in a resting EKG that looks relatively normal. Very important testing. I added this slide here, so you don't probably have it unless you have already downloaded what I'm about to save. So this is the ST segment elevation that I was just talking about. That's an indication of myocardial infarction, which is heart attack. I just thought that was another figure. I just Googled it, so I just happened to think that was a pretty decent drawing of the ST segment elevation. Doesn't do a really good job of the P wave, but that's for another day. So with regard to exercise prescription, there are 6 basic factors that are important to consider when prescribing exercise. I'm going to blow past this slide because we're going to talk about each one of these factors in the coming slides. So to design an exercise program to improve aerobic capacity, so think cardiovascular improvements. So think improvements in VO2 max. These are the 6 basic training factors. And these are training factors for overall general health. So this is not an athletic population. This is not a specific elite population or disease population. This is just in general. If you want to become more healthy, what do you need to consider when it comes to exercise? And mode is an important factor. It's basically, what do you want to do? What is fun to you? Do you like to walk? Do you hike? Do you jog, run? Would you rather get on a bike? Would you rather get in a swimming pool? Would you rather dance? It does not matter what you do as long as you are enjoying it. So the mode isn't necessarily the most important factor in exercise prescription, but it can be the most variable. And I'm going to say exercise, EX, RX, prescription, just to make it short so you don't have to keep watching me type. It should be enjoyable. It should be motivating. If somebody doesn't like to run, then don't tell them to run. If they enjoy dancing, tell them to dance. If you want to play tennis or racquetball, anything that just gets someone moving more is better, as opposed to just sitting on the couch and doing nothing. But oftentimes, multiple modes are better. So if you like to run, if you like to swim, if you like to bike, do all of them. So that if there is a given day where we've got inclement weather, we live in Texas, so the weather changes as you blink, you need to be able to adapt. So being able to do multiple things or enjoying multiple modes of exercise can prevent boredom, but also allows you to adapt and continue to exercise despite, I'm going to call it roadblocks, like weather, sickness, etc. Timing, like if you have kids or if you have a job. Time constraints, that's better. So mode is important. It's not the most important in exercise prescription, but it is the most variable. If you're bored with exercise, you're going to quit. So if you're bored, you're more likely to quit. And ain't nobody got time for that. With regard to frequency and duration, also important factors, but this will also depend on how much time someone has available, how much they are willing to dedicate to an exercise program, or how much they can physically dedicate to an exercise program. So frequency, with regard to how many times per week you're exercising, 3 to 5 days per week is optimal. But you have to start gradually. There was one group that talked about exercise prescription and training, and they said, at first, so in someone who is untrained, start with 2 to 3 days a week. That's manageable. If you can say on one weekend day and one weekday, go do something, go run, go jog, go bike, go swim, go hiking. Those 2 days, usually a weekend day because weekend schedules are different than week schedules, and one weekday, one weekday and one weekend day. Weekday gives your client the option to say, okay, here's my work schedule. And here's when I can fit in exercise. So it gives them an opportunity without overwhelming them to say, here's when I can fit this in. So you take one day a week. Here's my work schedule. Here's when I have to pick up the kids after work. Here's when I got to go to this club meeting. Here's when I have to go to class. Here's when I have to do this, that, or the other thing. Eat, sleep, breathe, you name it. But during the week, it gets busy. So find one day a week. And it doesn't have to be the same day every week, just one day during the week. Find time to exercise. Optimally, the duration should be about 20 to 30 minutes a day to start. So 2 to 3 days a week to start, and then build. Weekend day is usually easier to find time to exercise, and consequently, it's just more enjoyable. So it's easier to find time. Usually, sometimes, not always. Think about parents who have their kids are in multiple sports and they're playing games and practicing and all those fun things, which is wonderful. But I've seen parents at an athletic field when they're like, think baseball, for example. I have a little league baseball field right down the street from me. And I see parents, the baseball field is surrounded by a walking track. So I see parents watch their kid play during an inning, and then during the inning break, when they're switching offense to defense, they go for a walk around the track or a jog around the track. Or before the kids get started, they have warm-ups. So they'll take their kids and run around the track a couple times as a warm-up. You incorporate everything in your daily life into your exercise routine. And when you make it something that is a constant in your life, it's easier to sustain that and to constantly do it. So the other thing is people get hung up a lot on having to do 20 to 30 minutes a day. But if you only have time for one 10-minute bout here and another 10-minute bout there and another 10-minute bout there, then do those 3 10 minutes. But you can accumulate the 20 to 30 minutes. So if walking is your thing and you want to do a 10-minute walk in the morning, 10-minute walk on your lunch break, and a 10-minute walk when you get home, that 30 minutes is just as good as doing one 30-minute bout. And I am starting to lose light. Hold with me, guys, for a second. I'm going to turn my lights on. Okay. So frequency and duration are also variable. There are optimal numbers here. 3 to 5 days a week. Start with 2 to 3 days. If you instantly have someone start an exercise program and jump right into 5 or 6 or 7 days a week, they're going to burn out. They're going to get tired. They could even get hurt. So doing too much too fast, too much too soon, or too much too fast can cause burnout, fatigue, and if you're causing burnout and fatigue, or injury. And when someone gets injured, turns out they're probably not going to be able to continue to exercise, and they probably won't want to because it hurts. And if we hurt people and we cause them fatigue or burnout or injury, they're never coming back. So to keep somebody in an exercise program, you start them slow. You start them with a couple days a week, 1 weekday, 1 weekend day. Gradually, start with 20 minutes, start with 15 minutes. I don't care. Start with 5 minutes. Remember I said, convince somebody into 5 minutes, and chances are they're going to want to do more. So frequency and duration aren't necessarily the most important in exercise prescription. They're variable, but they can become incredibly important when it comes to starting gradually. You have to start gradually, or you will drive your client away. What is the most important factor in exercise prescription is intensity. And this is important because you have to tax yourself to stimulate improvements. Someone who is untrained has farther to go, has more to gain than someone who is already trained. And the more intense the exercise, the greater the benefit. So important points to make. The minimum recommended is 50 to 60 is exercising at 50 to 60% of your VO2 max. But that upper limit depends on the purpose of your training. Is cardiovascular exercise your point? Do you want to strength train? The upper limit seldom exceeds 80% of your VO2 max. And that's because it's not necessary unless you are training for a race or you're an athlete to train above 80% of your VO2 max. You can gain cardiovascular and cardiorespiratory health benefits from exercise by just exercising around 50 to 60%, just half of your max intensity. And it says, but more is better, right? No. The higher the intensity, the lower the volume. So think, excuse me. Yeah, nope. Intensity, the shorter the duration. Think you shouldn't be able to sustain high intensity exercise for long periods of time because it's highly intense. But the higher the intensity, the greater the aerobic gains. And you can see results in as little as 2 weeks. So intensity is super duper important. It is the most important factor in exercise prescription. And it's also incredibly individually dependent. So one person's 50 to 60% of max will be very different than somebody else's. So super important. Make note of that. With regard to exercise prescription, one of the best things that you can do for a client or even for yourself is to tell them to just sit less. Continuous sitting time, think 30 minutes or longer, has incredibly negative effects. Look at this. Insulin resistance is increased. So when you sit during periods of rest, your body transitions into an anabolic state. Remember what an anabolic state is. Anabolism or anabolic steroids are growth, synthesis, building, lots of things I can think of. Storing, so think storing fat. All of those things are happening in an anabolic state. Continuous sitting has an extremely negative effect on metabolism. Remember, your body only does as much as it needs to. No more, no less. So sitting will lower metabolism and promote fat storage. So think anabolism, growth, synthesis, building, storing. That storing is storage of fat. That's promoted when you're resting. These effects are not offset by regular exercise. So what's listed here is NEAT, N-E-A-T, non-exercise physical activity thermogenesis. We've talked before about how long people exercise every day. Some people exercise for 30 minutes. Exercise duration can equal 30 minutes. We just said recommended 20 to 30 minutes a day, 3 to 5 days a week, up to a few hours. But there's 24 hours in a day. So if you spend most of that time sitting, exercise will not offset the effects, the negative effects of inactivity. If you hear my dogs behind me whining, it's because it's dinner time and they need to wait a couple minutes until I'm done. So please, there's Copper Pot. This non-exercise physical activity is just moving. Anything beyond that's not exercise, beyond rest. So the more higher NEAT equals more calorie burn in 24 hours. So one of the biggest contributions to overall 24-hour calorie expenditure is resting metabolic rate. But one of the most controllable factors, that was Zoe, if you heard her in the background, sorry guys. One of the most controllable factors in 24-hour calorie expenditure is NEAT, non-exercise physical activity. Think just walking more, stand more, move more. The more you move, the more you burn, and the more less likely you are to become overweight or obese. The more positive the impact on metabolism and the positive impact on insulin resistance. The more you move, the more fuel you need. And the more fuel you need, the more your cells ask for that fuel by signaling through insulin. So a planned interruption of sitting time. So set yourself a timer every hour and just stand for a couple minutes. That can help prevent, it's one of the best things you can do to help prevent chronic disease. To monitor, so all of that is the modes of exercise, the different things we consider when we're prescribing exercise. Now, how do we monitor exercise? One of the easiest ways to monitor exercise is to monitor heart rate. Remember, heart rate increases linearly with increases in exercise intensity. So we know that, and we can test to measure something we call training heart rate based on this relationship, the linear relationship between heart rate, and it says here VO2. Remember, exercise intensity, VO2, volume of oxygen consumed per minute of time, because a given amount of work requires a given amount of VO2, and I'm just going to go ... because you know the rest. So because we know that as exercise intensity increases, heart rate increases linearly. So we can measure at different exercise intensities heart rate and calculate or know at that particular intensity what your VO2 is. So because there's a linear relationship between heart rate and VO2, we can measure heart rate at these exercise intensities. Here are all steady state heart rates. These are all steady state heart rates at different exercise intensities as indicated by an increase in VO2. Remember, because a given amount of work, exercise intensity, requires a given amount of VO2. I'm going to let my dogs out of this room so my husband can feed them. Go ahead, guys. Go, babies. Okay, so if we have the ability to measure this heart rate in a graded, this would give us, like, we could create this graph by running a graded exercise test. If we don't have the ability to run a graded exercise test, so let me write here, the graph shows results of a GXT, graded exercise test. We can use heart rate during training to track over time changes in fitness over time, because with training, submaximal exercise heart rates go down. But stroke volume goes up to maintain cardiac output. That, my friends, is all review. So we can use heart rate at particular exercise intensities and track that heart rate over time to see what's happening. Is it staying the same? Is it lowering? If it's staying the same, then we're not doing enough. If it's lowering, then we're doing our job. The Carbonin method is an easy way to calculate something called heart rate reserve, and then target heart rate. THR is target heart rate. And target heart rate is going to be very individually variable. So measuring target heart rate is something that is applicable and makes it specific to the person, to this particular individual. So we can measure heart rate reserve, which is super easy to measure. Heart rate max, right? Heart HR max can be calculated easily as 220 minus your age. So if you're 30 years old, your heart rate max is 190 beats per minute. Right? Got it? You can also then subtract that from your heart rate at rest. And that's something that you actually have to measure. Measure first thing in the morning, before you get out of bed. So after, we're going to call it 8 hours of sleep, in a completely rested state. So you measure heart rate at rest, first thing in the morning, before any movement, after 8 hours of sleep. You haven't gotten out of bed yet. Say, for example, this 30-year-old person, their resting heart rate is, I don't know, 60 beats per minute. So now we can calculate max heart rate reserve. Basically, how much are you able to increase heart rate from your own rest? And your resting value and your max value is variable from person to person. The max heart rate value in two 30-year-olds will be the same, but the resting value may be very different. So we calculate max heart rate reserve so that it's individually specific. So in this individual, the heart rate reserve is equal to 190 minus 60, which is equal to 130, right? So beats per minute. So the heart rate reserve is 130 beats per minute in this individual. And then we can take that value, that 130 beats per minute, that's how far we have to go from rest to maximum. And then we can calculate a target heart rate as a percentage of that heart rate reserve. So we want to say, we want to work at 70% of max in this particular individual, this 30-year-old with a resting heart rate of 60 beats per minute. So if we need to calculate the target heart rate, we take target heart rate, and that would be 70%. That would equal heart rate rest plus, so heart rate rest is 60 beats per minute, plus it would be 0.7 in this example, times the heart rate reserve, which is 130. And I am going to bust out the calculator to do this. Don't judge me. Please move this window away from the shared application. I will do that after I get my calculation. So we're going to go 0.7 times 130, because multiplication comes first, yeah, and then add 60. So we are going to add, for this particular person, all right, work right around 150 ballpark beats per minute. So 70% of this particular person's max is 150 beats per minute. So while they're exercising, we will monitor heart rate to try to maintain a heart rate of 150 beats per minute. So this is a really easy way to monitor exercise intensity, and that is individually very specific. So one of the best and easiest, cheapest ways that we can monitor exercise intensity, all you have to do is count your pulse over time. There are heart rate monitors that can monitor heart rate that make it a little bit easier, that shows up on a watch. But if you don't have that, or can't afford that, or don't have something like that at your fingertips, then you just measure heart rate. You can measure your pulse anywhere, at your wrist, on your neck, all over. So this is a really easy and efficient way to measure. And my dogs are back. They have already eaten. Hi, guys. I've got a couple more slides left. They're now begging to go outside. So if you hear any snorts in the background, those are my dogs. So typically, for example, I just gave you an example on the previous slide, we'll work between 50 and 75% of max heart rate reserve. And that will ensure that somebody's responding to their individualized program. But we'll start at the low end, so it's not too highly intense, so that we can work up gradually. There's Copper Pot. And basically we know, again, heart rate is correlated with cardiac work. So using the target heart rate ensures us that we work at a constant rate of work and a constant amount of work that's done by the heart regardless of environmental conditions. And this is really safe for high-risk patients because it is so individually specific. So the metabolic equivalents are something that one of the group presentations discussed. They did a really good job of showing you a calculation and how to calculate calorie expenditure. So 1 MET is basically the amount of, it's an indication of the amount of oxygen that you would consume at rest. So 1 MET is considered a resting value. It gauges the intensity of exercise based on oxygen consumption, because a given amount of work requires a given amount of VO2. So we know that at a particular intensity of work, you need to consume a certain amount of oxygen. There are published MET values. So this link the published MET values is an incredibly extensive book. So I gave you an example here in this figure of particular MET values, like bicycling at about a little bit less than 10 miles per hour is a MET value of 4. And again, you can calculate calorie expenditure. And I will show you how to do that. So you take the MET value and you multiply it by 3.5 milliliters per kilogram per minute. And then you have to multiply by this person's body weight. So let's say that this person that we talked about in the previous slide is 70 kilograms. So right now we've got, and they exercised for 20 minutes. We can calculate overall oxygen consumption in this bout of exercise, right? So it's 4 METs. So they were riding a bike leisurely, less than 10 miles per hour for 20 minutes. So here comes my calculator. If we've got a MET value of 4, is that out of my way? Okay. Times 3.5 times 70 times 20. The amount of oxygen that, whoops, I can't get this thing out of my way. Hold, please. I'm going to do this one more time to make sure I did it right. Times 70 is 980. Yep, times 20 minutes. Okay, so the amount of oxygen, 19600. 19600. So in 20 minutes, that person consumed, that's milliliters of O2, which is equal to 19.6 liters of O2. Okay, we can calculate oxygen consumption. Now there's a conversion factor, 5 kcals burned per 1 liter of O2 consumed. So this conversion factor allows us to calculate calorie expenditure during exercise. So if this person consumed 19 liters of oxygen, 0.6 liters of O2 in 20 minutes of exercise, and you multiply that by 5 calories burned per 1 liter of O2 consumed. Here comes my calculator again. 19.6 times 5. Did it work? 98. So you have burned about 98 calories in that 20 minutes of exercise. So we can use this MET value because we know that per each of these activities, there is a published MET value. So a given amount of work requires a given amount of oxygen. And 1 MET is equal to 3.5 milliliters per kilogram per minute, the units that we use to measure relative VO2. So we multiply the MET value by the oxygen consumption per minute of time at that MET value by body weight, and then also multiply the amount of time that that person performed that work, we can get how much oxygen that individual consumed per that 20-minute bout of exercise. And if we know how much oxygen was consumed in that 20 minutes, we can calculate the number of calories that person burned in that exercise, in that bout of exercise. So this calculation is really important to know and understand. Learn this, memorize it, put in different numbers, and do the calculation. You might see this on an exam. So again, this is just a short version, this table of this huge version here. But MET values are a good way to estimate intensity and work being performed during exercise, and also estimate calorie expenditure during exercise without any more fancy measurements, like having to measure VO2 or having to measure metabolic rate or anything like that, either directly or indirectly. So this is a really good estimation of calorie burn during exercise, because we know that per a given amount of work, you consume a certain amount of oxygen, and that oxygen that's consumed burns a certain number of calories. We can calculate that, and we just did. The negatives to this, the published MET values, they can vary quite a bit among individuals. It depends on, it doesn't take into account physical conditioning, so fitness, and it fails to account for environmental conditions, which can be, incline up and down hills. It can be elevation. So there's lots of things that aren't taken into account here, but it is a really good estimation of intensity of work and also calorie expenditure. So be familiar with that. It's a really good value. During exercise, so if you don't monitor heart rate during exercise and you don't calculate target heart rate, you can also use something called a rating of perceived exertion. This is an indication of how an individual feels, how difficult the exercise feels to a person. So this can be really subjective. So not always accurate. measurement of work. It's called the Borg scale. RPE is rating of perceived exertion, and it runs from 6 to 20. Why 6 to 20? I don't know. There's other scales that run from 1 to 10, 1 to 20. This one just happens to run from 6 to 20. It does correspond with heart rate, but again, it's a little bit variable because you're just asking an individual how they feel. But it can be very accurate when it's used correctly. So if the individual is being honest about how they truly feel, then this can be accurate. So very light exercise. So this scale runs from very, very light exercise to vigorous to as hard of exercise as you've ever done. And along this scale, during exercise, we just ask an individual to point to the scale and say, how does this exercise feel to you as a whole, as your whole body, not just in your legs, not just in your arms, but overall in your entire body, how does this exercise feel? So when they say, you know, it feels like a 7, that's very, very, very light exercise. Or maybe it feels like a 12. That's moderate exercise to them. So this is going to be, again, subjective and quite a bit individually variable. An indication of a maximal effort is an RPE greater than 18, greater than or equal to 18. So think 18 to 20. When someone gets up to that high of an intensity, they're about to max out. They're about to be done and can't do anymore. So during a graded exercise test that's maximal, we use RPE to ensure increasing intensity of work, but also make sure the subject is okay, it feels okay, and is putting in a max effort. So it can be really, really important. I just hit save. That's just a natural reaction. Every time I type something, I want to save it. So give me a second here for this PowerPoint slide to save. Of course, it's not responding. There we go. And then to finish up, when you're prescribing exercise in an individual exercise bout, there's 6 things to consider. Warming up and stretching is one of the most important things that you can do. We'll talk about all of these in the next couple of slides. So let's finish up with this. Warming up and stretching is one of the most important things you can do. You have to start with low intensity. So warming up is important. Start slow and low. So think jogging, jumping jacks, hops, skips, really low intensity stuff. And what that does is just increases heart rate and breathing rate to prepare you for more intense exercise. And a sample warm-up would be like 10 minutes of stretching and 5 minutes of low intensity activity. So think jogging, jumping jacks, hops, skips, things like that. Whatever you're into. It doesn't have to be anything specific. And the cool down is just as important. You should conclude every workout, every endurance workout needs a cool down. Do you have to stretch? No. But you should. Stretching, because flexibility is one of the most neglected parts of exercise. And inflexibility can cause joint pain, muscle pain, injury, etc. So being flexible is one of the best things that you can do for yourself. And when you're stretching, stretch after. If you're going to stretch and you're only going to stretch once, if you only choose to stretch one time, do it after exercise. That's when you're warm. VO2 is elevated. Cardiac output is elevated. Blood pressure elevated. Not tons, but enough. And body temperature and blood flow to muscle is all elevated, which facilitate your ability to stretch without injury. So all in all, stretching is a really good thing, particularly because more often than not, if you're going to exercise, most people neglect the stretching. So incorporate it. I'm going to flip back to this previous slide and just say warming up and stretching, cooling down is one of the most important things you can do in any particular exercise program. You don't have to do everything. You don't have to train for endurance, flexibility, and resistance, but over the course of a week, you should incorporate some of everything. You don't have to do everything every time, but over a week, do incorporate 1 through 6 in your exercise program. Always include a warm-up and a cool down. And then mix in cardio, strength, and flexibility. Depending on time constraints, needs, wants of your athlete, etc. So in saying that, I'm going to save this program or this PowerPoint and post this as an updated version. So I'll post it as like chapter 20 video lecture. So it'll be underneath the chapter 20 PowerPoint slides. So you have access to all of my notes. I'm going to go and sign off here. I will also do chapter 9 here in a couple of days. So look for that. It will be coming, but I wanted to get you chapter 20 sooner rather than later because your quiz that opens on Thursday will have a couple of questions, probably 4 or 5 questions from chapter 20. So I wanted to get this to you sooner rather than later. If you have questions, come to class with them or email me anytime. Thanks for joining me, guys. I will talk to you soon.